On behalf of the government of Rwanda, I would like to welcome you all to this very important event.
There was a recent study last year by the Lancet Global Health Commission, which actually found that 5 million yearly deaths occur in low and middle income countries as a result of poor quality healthcare. 5 million.
Africa can do better, ladies and gentlemen. The tools exist. People don't die because of lack of science to prevent premature death. They are dying because we have not decided to save them. And we must make that decision at this conference.
A few experiences that I learned on my bus experience I can share with you. All the people inside that bus have a place to sit. They can sit anywhere except the driver. The driver is the government. The government officers who are here, myself and my colleagues, we must lead this UHC.
What we hear is that countries are determined in their path towards UHC, and that more and more there is commitment in raising the financing to do so and to use it more efficiently.
On ne peut pas se permettre de dire on va développer la santé, on va mettre de l'argent dans la santé, on va laisser en amont les infrastructures. Parce que le citoyen lambda qui est au fin fond de la Casamance, qui est dans une zone éloignée, enclavée, il lui faut de l'infrastructure. Donc pour qu'il ait de la santé de qualité, il faut aussi mettre en corrélation, en parallèle, les infrastructures. Donc on ne va pas dire qu'on privilège un secteur par rapport à un autre. Je pense qu'on travaille pour aller de pair, ensemble. On ne peut pas juste...
The private sector has an important role to play, not only in terms of funding, but in terms of complementary expertise to identify new ideas, new solutions, and scale up.
I don't see any country who will be in the future able to pay for such transformation only from a public service budget. We need to really build the bridge with private sector.
We need to be able to make the private sector confident enough to come and invest in the country. The drone example, it's making a huge change in blood delivery in our facilities.
We should have a national health insurance scheme because really this is the way to go. We have an e-health policy. We need to use technology to improve our health care delivery in the country.
We had to have policies and strategies that are people-centered, that are community-centered. It's not about having the community as beneficiaries. It's about having communities as stakeholders.
When it comes to quality, the design of the intervention or the product or service that you want to offer at the community level must be designed to actually meet the gaps in that setup, and especially when you look at the rural areas where there's limited access to everything.
Health is made at home and only repaired in health facilities when it breaks down.
Divorcing universal health care from economics is also like a very grave mistake. We end up saying things like people need to eat healthy, when we know that a choice or the decision or the ability to eat healthy is an economic situation or positionality of people. And we end up saying things like people must drink water when people don't have access to clean water.
We need to be solutions focused. We all know the problems. If we go into the power tables and complain, they're not going to listen. If we come with solutions and a how-to, then we get somewhere.
I am still in the fight against FGM, and I know that together, when we all join together, just like you have been told, we bring on board men, we bring on board women, and we bring on board survivors like me who understand what pain is. Thank you very much.
In the final analysis, it only matters when life changes. The degrees, everything else, really, they don't matter. It only matters when there is a difference in people's lives.
Sometimes you have to climb over barriers to get to the people you need to get to. If there's somebody in need, then you've got to break down barriers. You've got to go the extra mile to get to that person.
if you have good outcomes, then your citizens have faith in your healthcare system. You can't do it all, but what you do, you must do extremely well.
I was recruited as a community reproductive health worker. Wow. Wow. So I want to testify to all of you that it works. As we talk, yes, through regular support supervision, mentoring sessions, and helping us to collect the data, analyze it, package it, give feedback, it worked.
It has been an absolute pleasure to host you in the city of Kigali, and I hope you've enjoyed it.